Do's and don'ts. Snake bite. If a snake bites, do's: remain calm, immobilize the bitten arm or leg, and stay as quiet as possible to keep the poison from spreading through your body. Remove jewelry before you start to swell. Position yourself, if possible, so that the bite is at the below the level of your heart. Cleanse the wound, but don't flush it with water, and cover it with a clean dry dressing. Apply a splint to reduce movement of the affected area, but keep it loose enough so as not to restrict blood flow. Don'ts. There are so many cases when poor access to health services and first aid medical treatment lead to fatal result with victim. Cleanse the wound but do not flush it with water and cover it with a clean dry dressing. Apply a splint to reduce movement of affected area, but keep it loose enough so as not to restrict blood flow. Do not use a tourniquet or apply ice. Don't cut the wound or attempt to remove the venom. Don't drink caffeine or alcohol. Don't try to capture the snake, but try to remember its color and shape so you can describe it, which will help in the treatment. Tight aerial tourniquets are not recommended. Why? Confining this toxin in a smaller area by use of compression technique creates a greater risk of serious local damage. When tourniquet is removed, there is a problem of venom rapidly entering the system and causing respiratory failure in the case of neurotoxic bites. The viper's venom contains procoagulant enzymes which causes the blood to clot. In the small space below the tourniquet, the venom has a greater chance of causing a clot. When the tourniquet is released, the clot will rapidly enter the body and can cause embolism and death. Lastly, there has been a great deal of research showing that tourniquets do not stop venom from entering the body. Another source of symptoms and signs not caused by snake venom is first aid and traditional treatment. Constricting band or tourniquet may cause pain, swelling, and congestion. Ingested herbal remedies may cause vomiting. Instillation of irritant plant juice into eye may cause conjunctivitis. Forcible insufflation of oils into respiratory tract may lead to aspiration pneumonia, bronchospasm, ruptured eardrum, and pneumothorax. Incisions, cauterization, immersion in scalding liquid, and heating over a fire can result in devastating injury. Frequently asked questions. What does the bitten area looks like? Do one need to cut the wound or remove venom by sucking or any other method. Don't cut the wound or attempt to remove the venom either by sucking or using any other method. Snake bite should be washed or flushed. Never wash or flush snake bite. Do one need to catch the snake and take it along in order to get correct treatment? No, no need to catch the snake. Just remember the appearance of snake and the time of bite. Some people suggest that pressure bandage is not a good option as a first aid to snake bite. Applying pressure band or cloth, not tourniquet, in the right way will reduce the spread of venom to the vital organs of the body. It is very effective in case of neurotoxic snakes such as karath and cobra. If the bitten snake is a viper, then the prolonged pressure bandage application may cause severe local tissue damage. Do we need to catch the snake to help the treatment? No, there is no need to identify the snake to decide the treatment. A doctor will look at the clinical symptoms to verify whether the snake bite caused envenomation or not. Once the envenomation is confirmed, then the doctor will start medication. So, if you have a dead snake, photo of the snake, then is it helpful? If there is a photo of dead snake, live snake, then share it with the expert who could help you in identification of snake in